5 common disorders that affect women during menstruation. Although most women have menstruation in common, it's not always a topic that is openly talked about. Because of this, many women don't know what is normal and what is abnormal when it comes to their cycle. Below are 5 common menstrual disorders that every woman should be aware of. 1. Heavy menstrual bleeding. A fifth of women bleed so heavily during their period that they can't complete daily tasks. Hormonal imbalances, uterine abnormalities, and other conditions can cause heavy menstrual bleeding. Heavy bleeding hinders daily activities. Common causes of menorrhagia are: hormonal disbalance, uterine fibroids, pelvic inflammatory disease, infection or polyps in the pelvic cavity, certain types of birth control devices, bleeding or platelet disorders, high levels of prostaglandins in the body, which control muscle contraction in the uterus. 2. No menstrual bleeding, amenorrhea. Amenorrhea is when a woman doesn't menstruate. Problems with estrogen levels can cause a woman's periods to stop for 3 months. Low body weight and pituitary maturation can cause it. Sometimes amenorrhea could also be because of medical problems or conditions, including the following: eating disorders, ovulation abnormalities, some kinds of birth defects, excessive or strenuous exercise, thyroid disorders. 3. Painful menstruation, dysmenorrhea. Menstrual cramps are caused by uterine contractions caused by prostaglandin Estradamus. Some possible causes of secondary dysmenorrhea include uterine fibrosis, pelvic inflammatory disease, abnormal pregnancy, infections like tumors and polyps that happen in the pelvic cavity. 4. Premenstrual syndrome, PMS. PMS is a variety of physical and psychological symptoms. 40% of women have severe PMS. Depression is the most common PMS symptom. Symptoms of PMS include fluid retention in the body, headaches, vertigo, muscle spasms, heart palpitations, skin problems like acne, gastrointestinal symptoms such as bloating, psychological problems such as depression, anxiety, and irritability. 5. Premenstrual dysphoric disorder, PMDD. Extreme PMS that disrupts women's lives. PMDD causes irritability, anxiety, and mood swings, like a headache versus a migraine. Common menstrual disorders symptoms. Long or heavy bleeding should be stopped to avoid complications. If you have any of these symptoms, see your gynecologist. If you have any of these symptoms, see your gynecologist. Pain and cramping, abnormal uterine bleeding, headaches, depression, abdominal bloating and fullness, emotional distress. If you have been experiencing some of the mentioned symptoms, consult a specialist, and they will provide you with additional information and treatment. Diagnosis and treatment. A gynecologist will ask questions to diagnose you. They may also need a menstrual cycle diary. U.S. women may need a pelvic exam, pap smear, and physical exam. Your doctor will discuss your condition and treatment options with you. Diet changes that might include reducing everything that can make things worse, such as salt, caffeine, sugar, and alcohol intake. Medical treatment includes pain relievers and hormonal contraceptives. Surgical treatment if the condition is severe and cannot be treated medically. With proper treatment, women with menstrual disorders can live happy and healthy lives. Many women have menstrual disorders, but seeking help can prevent further health problems. This content is not meant to replace medical advice, diagnosis, or treatment. Always consult a doctor if you have medical questions. This blog is informational and not medical advice.